Type 1 diabetes is an autoimmune condition, so that means that the body starts to attack healthy cells. For type 1 diabetes, the body starts to attack healthy cells found within the pancreas, specifically the beta cells. Now, beta cells found within the pancreas are responsible for the production of insulin. Insulin is a vital hormone that is responsible for the regulation of blood glucose levels. Now, there is no known cause of type 1 diabetes. However, we know that it's not as a result of our lifestyle choices, such as type 2 diabetics. Although there's no cure for type 1 diabetes, a healthy lifestyle can help to manage the symptoms and reduce the complications of this disease. Type 1 diabetes represents around 10 to 15% of all diabetic cases within Australia, and around 120,000 Australians have this condition. It is usually diagnosed during childhood. If type 1 diabetes is left untreated or undiagnosed, it can cause many significant problems. Now, if type 1 diabetics don't monitor their blood glucose levels, many side effects and many other conditions can arise, such as heart disease, kidney disease, blindness due to neuropathy in the eye, amputations due to neuropathy in the limbs, causing infections, persistent infections, and ketoacidosis. So it's really important that type 1 diabetics monitor their symptoms closely and are really sort of on top of their insulin levels. So without insulin, our body is unable to break down and transfer blood glucose from our bloodstream into our cells to be used as energy. And our body likes to use glucose as the primary source of energy. So if it's not getting enough glucose from the bloodstream into the cells, what happens is we get hyperglycemia, so a really high level of blood glucose in the bloodstream, and we can also get what's called ketoacidosis. Ketoacidosis occurs when the body starts to use fat for energy rather than the glucose. When our body breaks down the fat, it creates ketones. Now, an elevated ketone reading in our bloodstream can be really, really dangerous, as can hyperglycemia. So left untreated, this can be potentially life-threatening. So it's important that the blood glucose readings are checked regularly and that the person is using either an insulin injection or a pump to maintain those healthy readings. Now, we know that exercise is important for everybody. Now, it's particularly important for diabetics, and it should form a part of the treatment management plan. So exercise actually helps the insulin within your body to work more effectively and efficiently and to help normalize those blood glucose readings. Exercise also helps to maintain a normal body weight, reduce the risk of heart disease, and it also helps to lower the stress that is related to managing this type of condition, because it can be quite stressful and it's a lot to think about and consider. So we should aim to exercise for at least 30 minutes a day, and this can even be broken down into 3 10-minute time slots. Exercise should be a nice mix of aerobic exercise and a resistance-based exercise. So we're using both our cardiovascular system and our musculoskeletal system. So some considerations before a type 1 diabetic starts exercising. Firstly, it's important to check the blood glucose levels. Being hypoglycemic or hyperglycemic and then exercising can pose many problems. So it's important that we're exercising in a nice, happy range with the blood glucose levels. The second tip is to drink plenty of water before and during exercise to reduce the risk of dehydration. It's important that type 1 diabetics also check their feet before and after exercise. Now, if type 1 diabetes has started to worsen, we can get what's called peripheral neuropathy, so we're quite numb underneath the feet. Now, like I've already said, type 1 diabetics are also prone to infection. So being numb under the feet and also being prone to infection, if we have a little cut under the foot, this can cause an ulcer and lead to horrible infections. So if you're exercising with like running or something that's quite load bearing on the feet, it's just important to check that the feet are nice and clear of any sort of cuts so that we don't run into any problems down the track. Lastly, it's important that you talk to your doctor to determine whether you need to be having extra insulin before and after exercise. So you need to have sort of an injection plan made up with your doctor so you know exactly what you need to be doing before you're exercising and after you're exercising. Now, exercise should be under the guidance of an exercise physiologist if you're just starting out. That is because exercise can cause further complications to your condition. We don't want exercise to make you go too low with your blood glucose, and we don't want you to be too high. So an exercise physiologist understands what the normal safe readings are, and they can help to sort of look out for any problems that you might be having. So start slowly, talk to your doctor, and find an appropriate exercise professional to help you get started. And you'll find that exercise is going to be a really positive addition to your existing management plan for your diabetic condition.